Good afternoon. My name is Chesnie Cox, and as part of an assignment for the DNP coursework at Tennessee Tech University for Dr. Mickelson, I'm going to present to you today some information and data on the avian influenza virus and the DNP's role in public health crisis. At the conclusion of this presentation, the participant will be able to accomplish the following. Know what the avian influenza virus is, including signs and symptoms, diagnosis, treatment, and mortality rates. Discuss the current situation of the highly pathogenic virus in the United States and worldwide and explain how the disease can be slowed or stopped. Discuss public health entities like the World Health Organization and Center for Disease Control and Prevention's role in surveillance and detection of the virus in humans. And discuss the Doctorate of Nursing Practice prepared nurse leader's role in preparedness for an epidemic, pandemic, or endemic of an emerging infectious disease. What is a zoonotic disease? There are 4 types of influenza viruses, and we're going to give you a little bit of background on that pathogen. There's A, B, C, and D. A, B, and C have infected people and cause disease. Influenza A viruses can be classified into 2 types, and they can also affect poultry, pigs, and other animals. Sporadic animal to human transmission can occur, and seasonal A and B have the potential to cause annual epidemics, and according to the World Health Organization, influenza type A viruses are most significant to public health as they have potential to cause an influenza pandemic. Influenza occurs globally with an annual attack rate estimated 5 to 10% in adults and 20 to 30% in children. Zoonotic influenza occurs when humans are infected with influenza viruses that animals can be affected with, and humans contract the virus from direct contact with infected animals or contaminated environments. Historical data shows that all pandemic influenza viruses originated from animals, and all subtypes of influenza type A viruses have zoonotic potential. Let's talk about how the pathogen is tracked and reported. We have the World Health Organization, who is the leader of tracking and reporting any type of emerging disease that may affect the populations globally. The WHO requires international health regulations and reporting of novel infections such as influenza. There's 147 World Health Organization national influenza centers in 123 member states. There's 7 WHO collaborating centers for influenza, one of which is the CDC. So the Centers for Disease Control and Prevention, or the CDC, supports the WHO with global influenza surveillance and response systems. The United States Department of Agriculture, or the USDA, works with state and industry level systems to help surveillance viruses that may be circulating in swine or other animals in the U.S. and works to improve animal health and also contribute to vaccinations. Universities such as Ohio State University and other healthcare systems such as St. Jude's Research Hospital also participate in voluntary surveillance and contribute to animal and human interface studies. The Department of Animal Health and National Animal Health Laboratories are international veterinary agencies that also help participate in voluntary surveillance of novel influenza and other zoonotic viruses. Today's presentation will focus on the avian influenza virus, also known as H5N1. What is avian influenza? It primarily infects birds, but it also can infect humans as well. It's contracted from sick birds, but it can be passed from person to person after a human has contracted the virus. It is treatable, but it carries a higher mortality rate in infected humans, making it a concern for public health. The World Health Organization for Animal Health recognizes it can be detrimental to the poultry industry and affect farmers and international trade because when there's an outbreak, it's policy to cull all poultry, which can cause heavy economical losses for farmers with a long-lasting impact on their livelihoods. Transmission with avian flu is like any other influenza pathogen, but it is transmitted mainly from infected birds who have interactions with mammals or poultry in private facilities. While transmissions to humans is uncommon, it is possible and mainly results from direct or indirect contact with infected birds or contaminated surfaces or environments. According to the World Health Organization, studies have shown that human exposure most commonly comes from humans who work directly with specific animals, such as those in live bird markets, poultry farms, and those involved in slaughtering or defeathering poultry. Human transmission occurs when the virus enters through a person's eyes, nose, or mouth, or is inhaled. This can happen through droplets or possibly even dust as a person breathes it in, or when they touch something where the virus is present and then touch their mouth, eyes, or nose. The figure on this slide, provided from the WHO website, gives us a visual of how zoonotic viruses are commonly transmitted to humans. As you can see, the viruses normally only pass between animals, but it can be reassorted to humans through exposure. These viruses will have the potential to then reassort from animal to human and then human to human. The reassorted virus will have characteristics of a new influenza strain or potentially characteristics of a pandemic virus. According to the World Health Organization, seasonal influenza refers to viruses that have adapted to human species. The viruses, which can be influenza A or B, can cause respiratory symptoms that spread between humans, causing mild to severe illness. Zoonotic influenza would be considered a non-seasonal influenza. It can be transmitted at any time of the year, depending on exposure of infected animals to humans. Symptoms can range from no symptoms at all to mild to severe, and fever may not always be present. Some mild to moderate symptoms to look for is eye redness or conjunctivitis, flu-like symptoms, including upper respiratory symptoms, with fever, cough, sore throat, runny nose, muscle and body aches, headaches, and fatigue. Your most common influenza symptoms. Severe symptoms can be severe respiratory symptoms that cause severe shortness of breath or difficulty breathing, pneumonia, high fever, sepsis, or even death. Less commonly, some GI symptoms have been noted, such as diarrhea, nausea, vomiting, and seizures. So diagnosis comes from clinical symptoms and possible exposure. The healthcare provider will take an assessment of clinical symptoms based on possible exposure, but also there is lab testing that can be performed through a nose or throat swab. Again, that is confirmed in the lab. It's most accurate when collected at onset of symptoms. The CDC and the WHO provide diagnosis criteria and update guidelines accordingly on their website. In critically ill patients, collection and testing of lower respiratory tract specimens such as sputum collection can lead to diagnosis. It is harder for patients who have fully recovered or those who have mild symptoms to detect the virus. The CDC does have guidance for clinicians to follow in the United States on appropriate testing, specimen collection, and the processing of those samples for avian flu. According to the CDC, the best way to prevent avian flu is to avoid the source of exposure. For workers who are exposed to wild birds, alive and deceased, or poultry farmers, PPE such as gloves, N95 respirators, eye protection, and well-fitting face masks, as well as changing clothes after handling birds is recommended. Changing clothes and showering immediately after handling birds is recommended. Exposure can be higher with other groups such as hunters or bird owners as well, but it is recommended to wash hands with soap and water and avoid touching contact areas such as the mouth, nose, or eyes after any contact with birds or surfaces that may be contaminated. The main things that the CDC mark as prevention is, of course, avoiding direct contact, not touch surfaces that may be contaminated, hand hygiene, personal protective equipment for workers, seasonal flu vaccine compliance, and isolation immediately if exposed. The CDC currently recommends treatment with a neuraminidase inhibitor, which is a class of antiviral drugs that block the neuraminidase enzyme, which is responsible for influenza reproduction. The CDC suggests that most avian influenza circulating worldwide have been analyzed and are susceptible to the listed antivirals. Antivirals can help shorten the duration and or lessen the severity of symptoms, and it is advised to take as soon as possible after exposure and symptoms for best results. Other treatments is like with any other influenza and just treating the symptoms with primarily rest and flu as in any over-the-counter anti-inflammatory or cold and flu medications to relieve body aches and fever and other associated symptoms. Steroids are not recommended as they have been associated with longer viral clearance and immunosuppression, which may lead to bacterial or fungal superinfections. Ongoing sporadic circulation of outbreaks in poultry make it a public health concern, as these viruses have the potential to mutate and increase transmissibility among humans. The diversity of the zoonotic influenza virus is alarming to the public health entities, and continuous surveillance in animal and human populations is ongoing. According to the CDC on May 15th, CDC and representatives from across Southeast Asia and in Bangkok attended a workshop for avian influenza. On April 17th, a human infection was reported in Chile, and on April 10th, 2023, a human infection was reported in China. As of 6/1/2023, 7,098 wild bird cases have been detected. 58,789,591 poultry have been affected. One human case in the United States has been detected, with 47 states with poultry outbreaks. And the CDC offers guidelines on protection, handling of wild birds and dead wildlife, traveling concerns, clinician and public worker updates, and encourages seasonal influenza vaccines. According to the World Health Organization, sporadic cases of avian flu have been reported in the United States, Canada, and other countries. Risk to the general public is low at this time, and the first case in the United States was reported in April of 2022. Only 4 human infections have been identified in the United States. As of right now, the flu remains primarily an animal health issue, and the CDC and WHO are monitoring closely. The CDC has determined the H5N1 virus detected late in 2021 and 2022 is different from earlier bird flu viruses. 11 human cases have been reported globally since December of 2021. The World Health Organization just updated surveillance numbers on June 23, 2023. According to their data, 874 cases have been reported globally since January 2003 as of April 24, 2023. Of those reported, 458 were fatal, and the cause fatality rate is 52%. The last case was reported from Cambodia in February of 2023. The WHO discusses ways to slow or stop the virus, and everyone has a part in stopping and slowing the virus. The WHO recommends regular hand washing and proper drying, good respiratory hygiene, such as covering the mouth or nose when coughing or sneezing, and disposing of contaminated tissues or cleaning supplies after use, shower and immediately removing and washing clothing after handling wildlife or poultry, and early isolation if feeling sick, and of course, avoiding close contact with sick people and avoid touching the face, especially the eyes, nose, and mouth. So the DNP leader's role in public health. Some things that are important to note in their role is leading efforts to attain optimal health for populations, whether on a local, national, or global scale, leading health policy development at all levels to address health disparities, leading healthcare reform efforts within and across healthcare systems, collaborating with local, national, and global government entities to develop health initiatives, developing programs designed to improve the health of populations, and establishing public health priorities in a confident and articulate manner. The DNP prepared nurse leader must continue to build on their knowledge of evidence-based practice to cultivate a broader use of evidence in their decision and practice implementations. Nurse leaders have the power to create a culture of innovation that utilizes the best available evidence. Therefore, DNP prepared nurses can participate in delivering successful outcomes that support the practice environment, organizational success, and healthcare outcomes. By creating a culture of inquiry that utilizes the best available evidence, nurse leaders can participate in delivering successful outcomes that support the practice environment, organizational success, and healthcare outcomes. DNP nurse leaders have roles in public health that include leadership, educators, responders, policymakers, researchers, and they must integrate current evidence into bedside practice, use nursing theory and scientific principles to guide nursing practice, and enhance clinical environments with knowledge, skills, and insights gained from their educational coursework. DMP leaders can use the best scientific evidence in combination with the nurse's professional judgment and experiences and the patient's preference. The DMP nurse leader will be able to adopt evidence-based decision during public health crisis, and they have rich skill sets in policy development, financial skills, informatics, patient-centered care, quality improvement, safety, and of course, interprofessional teamwork and collaboration. The DMP nurse can use evidence-based management approach to plan when the future is uncertain, like with a public health crisis. An example would be a DNP prepared nurse leader using their skills and knowledge for resource planning during a healthcare crisis. Public health crisis would challenge nurse leaders to adopt decision-making practices, and their educational background and knowledge in evidence-based practice make them champions to support new nursing models in practice to meet the needs of communities during crisis. So, to summarize all the information from today's presentation, the influenza A virus is a continuously monitored and is of significance to public health due to its potential to cause an influenza pandemic. Avian, swine, and other zoonotic influenza infections in humans may cause disease ranging from mild upper respiratory infections like fever and cough to rapid progression of severe pneumonia, acute respiratory distress, shock, or even death. The CDC, World Health Organization, and other public health entities work collaboratively to provide continuous surveillance of potential and emerging illnesses and diseases that could lead to public health crisis. Guidelines for avian flu can be found on the World Health Organization or the CDC website, and everyone has a part to play in prevention. Being cautious when handling wild birds or poultry, as well as being compliant with yearly influenza vaccines and hand hygiene, will lessen the likelihood of contracting and spreading zoonotic diseases. The doctoral prepared nurse leader can use their experience in the field, education and knowledge, and professional judgment to adopt evidence-based practice when the future is uncertain, like with a public health crisis. Whether currently circulating avian, swine, or other zoonotic influenza viruses will result in a future pandemic is unknown. However, zoonotic influenza viruses have caused human infections throughout the world and have been a rising concern for the past year globally. Therefore, through thorough investigation of every zoonotic infection and pandemic preparedness planning, it is essential. References are provided on this slide, and for additional information or resources on avian influenza or any other emerging zoonotic disease, you can visit the CDC or WHO website. Thank you for your time today, and this concludes my presentation.